Hi, this is Teresa. I'm doing my first clinical conference. Don't mind me, I just worked all day and had a very hard day, so I'm just getting home. In this video, I give him a diagnosis of persistent complex bereavement under the Axis 1. He does not have a diagnosis in Axis 2 or Axis 3 because no medical conditions were noted. Axis 4, he does fit in there because a close friend died that caused disruption in his social and support systems. Axis 5, I give him a GAF of 10. That is because of the persistent danger and hurting himself and actually trying to act on his thoughts. So he should have at least 6 symptoms to qualify for the persistent complex bereavement. So his SI has started, it's been going on for at least 12 months since the traumatic event of his close friend dying. His SI is reoccurrent. He appears to be depressed. He is preoccupied with the death of his friend, and he's showing emotional pain. His differential diagnosis that I give him is post-traumatic stress disorder. He has experienced a traumatic event that is causing his suicide ideation and his intrusive symptoms such as avoidance and thoughts of killing himself. And then, let's see here. And then, some other things I would ask him is, does he have a family history of mental illness, especially like his mom, his dad, his brother, sister? And I would ask him if he's experienced any insomnia. Is he eating okay? Any auditory hallucinations, visual hallucinations? Does he feel paranoid? I would ask him how he tried coping with the stress of his close friend dying. Did he try anything else besides just trying to kill himself? I would ask him if he's experiencing any guilt about his friend dying and he's still alive. So etiology, I would say, is the death of his close friend is the prime causative factor that is causing him to have his SI. He may be experiencing the guilt feelings, which is also referred to as survivor guilt, because he is alive and they are dead. He is also lacking adequate family and peer support systems. So I would try to get him involved back with his family, get him to move out of the dorm and back in with his family just to get a good support system going. Maybe refer him to some outpatient center to follow up with after he is discharged from inpatient psych. So, yeah, definitely admit him inpatient psych, put him on the high risk suicide precautions. I would probably start him on Clozaril, an antipsychotic, because I read that is better than SSRIs, because SSRIs do work, but the antipsychotics have been proven to work better, even though Clozaril does cause agranulocytosis and has a lot of side effects. He is a healthy young boy, so I would draw some labs CBC, monitor his white blood cells, 2 different lab draws before he starts the Clozaril, just to get a baseline. And then I would continue to draw a CBC once a week for the first 6 months, because that's when the side effect, the agranulocytosis, could happen the most, is within the first 6 months of taking the medication. I would also get fasting glucose and lipids, since Clozaril causes weight gain. It increases your sugar. I'd get a CMP also. And that is all that I have. Thank you.